Welcome to Alpha Coding Podcast, an all-access pass to medical coding and billing pro tips that help you start your week off smarter. And now, here is your host, Toni Elhoms.
Hello, everyone, and welcome to the Alpha Coding Podcast series. I am your host, Toni Elhoms. Welcome to episode 17 of the podcast. Today is April 27th, and I hope everyone is doing well, staying safe and healthy, and most importantly, staying sane in all of this chaos. So we have surpassed 8,500 downloads on the podcast, and for only being on the air for 4 months, that's pretty impressive. So I want to give a big shout out to all of our listeners and followers. That's incredible, and we really appreciate your support. So our topic for today is going to focus on my top 5 pro tips for understanding Modifier 57 compliance. So I wanted to do something non-COVID and non-telehealth related since I recently presented on this topic for Pioneer Educator for an on-demand webinar, and I thought I'd share some helpful tips because we're about to get really busy with all of the backlog of elective cases that were canceled. I think this is the perfect opportunity to cover this topic. So before we dive into our topic, it's time for your Monday dose of positivity, the Mindset Monday tip, and it's brought to you by Clara. Clara is a holistic, secure communication platform that specializes in telehealth and telemedicine. Take your practice virtual in a matter of minutes. Mention my code Alpha Coding for 10% off. Visit Clara.com for more information. So our Mindset Monday tip is all about the importance of investing in yourself. And the quote I want to share with you says, "Work at your job and you'll make a living. Work on yourself and you'll make a fortune." So as an entrepreneur, I completely agree with this quote, and I try to live by it every single day because I think you are your most important investment. In fact, investing in yourself is the single most important investment you will make in your lifetime. It pays the highest return rate plus interest. Just as you would invest in your retirement accounts or real estate, you must equally invest in yourself. So no matter how much I have going on the hectic days, I always make a conscious and intentional effort to feed my brain. So I always strive to read 10 pages of personal development on a daily basis. And on the very hectic days or days that I travel, I'll listen to an audiobook or a video, but something that is feeding my brain and really helping me grow and level up on the personal development front. And any successful entrepreneur will tell you that they do this. This is part of their daily success routine. And I started doing this years ago and saw a huge difference in my mindset and my success. And so make this a priority. You are worth it. And every single dime spent or time spent on yourself is always going to pay a huge return on investment. So that's your Mindset Monday tip. I hope that brings you some positivity. So today we're going to cover my top 5 pro tips for understanding Modifier 57 compliance. It's kind of refreshing to talk about something that's not related to the pandemic or telehealth, so I'm excited for this episode. This modifier causes a great deal of confusion. Even the most experienced coders get confused on the application. I see this modifier applied incorrectly more than I see it applied correctly. And part of the reason why is because of the lack of understanding for its practical application. I do a lot of compliance audits, and this is one of the things I look at specifically with surgical and procedural practices. And this is the perfect timing to talk about this subject because a lot of the elective surgery cases are going to be starting back up again soon, and the ORs are going to be full. There's going to be so much backlog. So this brings me to my pro tip number 1. Modifier 57 applies to evaluation and management services only. So this modifier is going to be huge for surgical practices like orthopedics, neurosurgery, but also for cardiology because there are many procedures that have the 90-day global period like ICDs and pacemakers. So this is similar to the Modifier 25 in that it's reserved exclusively for E&M services, whereas the Modifier 25 applies to minor procedures, 57 applies applies to the major procedures. So having that fundamental knowledge base on the global periods is really important, what's included in them and how they're defined from a payer perspective, because there are 0-day global period, 10-day global period, 90-day global period, and then there are services that have no global periods. And so there's all these rules that you want to be aware of. But as far as the 90-day global period, this is going to be the major procedures or surgeries that have the 90-day global period indicator. So this includes the day of, the day before, and the number of days following the surgery. So in the instance of a 90-day global period, that would be 92 days total. So it's a little bit misleading in that you think it's 90 days and that's it, but it's actually a total of 92 days. And keep in mind with Modifier 57, it's applied to the evaluation and management service because you're saying that you want that pre-surgical or that pre-procedural evaluation and management service covered and reimbursed, not included in the global package. And keep in mind the procedure may or may not be necessarily surgical in nature. It could be more procedural. So an example of that would be non-operative fracture care that has a 90-day global period, and it doesn't sound like it would have that major surgical implication, but from a payer perspective, it's considered a 90-day global period procedure. So pro tip number 2, understand the true definition and practical applications of Modifier 57. So this is a CPT modifier and it's defined as the decision for surgery modifier. And again, this is going to apply to major surgeries or major procedural services. And it can apply to all of the evaluation and management codes, so 99201 through 99499, as well as the ophthalmology evaluation and management codes 92002 through 92014. And then again, this is the initial evaluation prior to a major surgery and or procedure, and this is always payable. It needs to be appended to any evaluation and management service on the day of or the day before the procedure or the surgery, because that E&M service results in the decision for surgery. And this informs the insurance company or the payer that the provider determined the surgery was medically necessary. So without the modifier, there can be a lot of implications. So understanding the practical application of this modifier is really important. So pro tip number 3, the timing of the evaluation and management service determines whether Modifier 57 is applicable or not. So here it's really important that you append where the decision for surgery is made when it's the day of or the day before a major surgery during an evaluation and management service. So if your provider decided to do an elective surgery and it's scheduled for 2 weeks from now, you wouldn't apply Modifier 57 to that evaluation and management service because it's not going to be required to distinguish the payment for the pre-surgical evaluation and management service. So this is where I think a lot of folks get confused. So here's an example. A 70-year-old patient presents to the ER with acute abdominal right lower quadrant pain. So after a detailed history and physical exam are completed, the decision is made to take the patient immediately to the OR for an appendectomy. So the initial hospital visit would be 99221, and then Modifier 57 would be applied to that in addition to the appendectomy CPT code 44950. So without Modifier 57, there might be a potential for a denial on the initial admission visit. So use of this modifier will allow separate reimbursement for the surgeon's visit on the day of the surgery, and it won't be included in the global surgical package because it's reported with Modifier 57. If the decision for surgery was made a week prior, no modifier would be reported, and the visit on the day before or the day of the surgery is considered inclusive in the global surgical package, and there's no extra allowance given. I see this a lot of times done incorrectly in the compliance audits that I do. Modifier 57 is put on the E&M service from 3 weeks prior to surgery, and then we see another office visit done the day before and another Modifier 57 applied to that office visit, and then of course that's a problem because it's incorrect. For one, because the day before would not be payable because the decision for surgery was already made, and you're also going to have some issues with the frequency of Modifier 57 application. So those are all things you want to be aware of. So pro tip number 4, understand the financial financial implications of Modifier 57. So applying it incorrectly as well as missing the application of it can cause a lot of systemic issues for a practice. And I've seen this over and over again, especially in small practices where there isn't a whole lot of oversight. Maybe there's a couple of billers or there's one person in the office that is tasked with all of the surgery coding and billing, and then there are some issues and they're not identified until much later. So missing the modifier can cause denials. So for example, if that major procedure is completed, you've got that appendectomy, it's been billed out, but the preceding evaluation and management service didn't have the modifier 57 appended, then the payer's going to assume that that E&M was inclusive to the other services billed and is not going to reimburse separately. So that's where you want to make sure you're capturing the modifier and applying it when it's appropriate, because missing it will cause the claims denials. And then conversely, applying this modifier for incorrect reasons can cause a lot of issues and increase your at-risk revenue category. So if a procedure or surgery is predetermined and you're seeing the patient for a pre-procedural or pre-surgical visit, this is not reimbursable. I see this all the time, and you just can't do this because it's already happened. And modifier 57, by definition, is the decision for surgery modifier. So if that decision has already occurred, you can't reapply the modifier because that's already been determined. So pro tip number 5, as with anything, compliance is critical. So this is not the modifier to resort to in order to get your pre-op H&P covered. And I'm talking to a lot of practices when I say this because I see it done all the time. So patient has already been determined to have a surgical procedure. They've been scheduled, and then the day before they're seeing the PA for a pre-op H&P, and that pre-op H&P is not reportable because the decision for surgery was already determined by the surgeon. So this is not a way to just get those pre-op H&Ps covered. That's not appropriate, and it's also fraudulent billing practices. And much like modifier 25, this is a hot topic modifier. It's frequently on the OIG work plan because it's a misunderstood and abused modifier. So auditing is critical. The more frequently you audit these services, the quicker you can respond and correct any deficiencies. I see practices that may audit once a year or once every couple of years, but doing that is really doing yourself a disservice because then you have to go back and make corrections and self-report a lot of data, a lot of claims. And you just don't want to get into a situation of trying to do that. That's staff time. That's all of this back and forth with the insurance companies. That's going to mess up your AR. It's going to mess up all of your reports. So auditing is critical. Audit on a quarterly basis at minimum, and then even a monthly basis if possible. Also keeping in mind that you're only as good as the person that's auditing your services. So if the person that's billing and coding your services is also auditing these services, that's going to cause some issues because you may not get the full picture. You may not get the true accurate results because there's some bias there. Maybe there's some issues with accountability, and maybe that person might be afraid that they're going to lose their job or be reprimanded for identifying errors that may have been caused by them. So having external audits gives you really good visibility into your at-risk areas and areas for overall improvement. So just to summarize, my top 5 pro tips for understanding Modifier 57 compliance. Number 1, Modifier 57 applies to evaluation and management services only. Number 2, understand the true definition and practical applications of Modifier 57. Number 3, timing of the E&M service determines Modifier 57 application. Number 4, understand the financial implications of Modifier 57. Number 5, as with anything, compliance is critical. So it's time for this week's coding pro tip, and it's brought to you by Project Resume. When is the last time you had your resume updated? Your resume is literally your entry ticket to that next great opportunity. Project Resume will design a customized ATS-friendly resume to demonstrate your unique skills and experience. And even better, it's written by coders for coders. Make that investment in yourself today. Visit projectresume.net and mention my code ALPHACODING for special pricing. So if you have a coding related question and would like it to be featured in one of our coding pro tips, please feel free to reach out to me on LinkedIn, Facebook, Instagram, or YouTube. So this week's coding pro tip comes to us from Colorado. Hi, Toni. Can you tell us the appropriate CPT code to use for a regular Medicare patient who had a telephone visit with a nurse practitioner? The NP had a 15-minute telephone discussion with the patient's legal guardian because the patient is incapacitated. What can we bill for? So this is a good question. The correct CPT code would be 99442, and this is a time-based telephonic service. So this would be the appropriate code to report because there was no two-way audio video used, and that would be required for the standard E&M services. And these telephonic E&M services can apply to the patient, parent, or guardian. So the fact that the MP talked to the patient's legal guardian is not going to hinder your ability to report this telephonic service. So the CPT code is 99442. So just as a reminder to everyone, if you like what you're hearing, hit that subscribe button now so you never miss another episode. Also, be sure to drop us a rating and review on iTunes. We really appreciate your support. So this concludes today's episode. I hope that my pro tips on Modifier 57 will be useful. And until next week, thank you for listening to Alpha Coding Podcast. We'll see you next Monday.
For more information about medical coding and billing pro tips, including how to hire alpha coding experts, follow us on LinkedIn, Instagram, Facebook, YouTube, or visit our website at www.alphacodingexperts.com.